Hey there, and welcome back to On the Beat. Isaac hosting again this week, and this week's topic is all about gastroenterology. I have with me doctors Johnston and Gillespie with Gastroenterology Associates of Columbus and Starkville. Mouthful, but I got it right.
That's right.
Right? All right, so the first question, three-letter word, gas. Tell us all about it.
Gas. We see it quite commonly in our practice, so it's definitely a hot topic to talk about. But gas in general is, air in the intestinal tract, and it can get there for a variety of reasons we can talk about, and people can expel gas or not and have symptoms related to it. So it's a very common GI complaint that we see.
Okay, and symptoms of it, Dr. Gillespie, we'll ask you this. What are how does the air in the intestinal tract manifest?
Well, you generally, a lot of people complain of abdominal swelling, pain, bloating, and you can also have burping, flatulence. Those are the main symptoms. It can also, if it gets really bad, cause a lot of pain. Sometimes people have associated diarrhea, things like that.
Okay, so why, you mentioned there could be a multitude of reasons for this. What would be an example or two examples?
Well, to his point about the different symptoms, and that's important for us to determine when people come in, because a lot of people come in and just say, I have gas. And that means different things to different people, so it's important for us to get them to explain to us, what is gas to you? Is it the belching? Is it passing gas? Or is it just that bloating sensation?
Okay.
But what I tell people, number 1, 2, and 3 on the list of causes of gas is bacteria in our intestinal tract and the things that we eat. I meant really diet is number 1, but due to the bacteria in our intestinal tract. We have more bacteria in our guts than we have in cells in the rest of our body. And
that seems concerning.
Yeah, well, it's normal, and we couldn't survive without them. They help us process food and nutrients and minerals and such.
Okay, so Dr. Gillespie, after all this, when does it get concerning as a doctor? What would you start to be concerned about if a patient tells you something?
Well, generally, some gas is normal, but if it starts interfering with your daily life, causing a lot of pain, or if you have any what we consider alarm symptoms, such as bleeding, weight loss, things like that, then we get concerned about maybe some other things going on.
Sure. And that would probably fall outside of the diet. Probably a bad diet probably wouldn't cause that, right?
Right. But that would be the kind of thing where we would want to do more testing and not say this is just gas.
Okay, fair enough. Yeah. So what other symptoms or conditions can cause an increased amount?
So there's certain things we like to make sure people don't have before we talk it up to just being diet related.
Okay.
Celiac sprue, which is an allergy to gluten. Gluten's a protein that's in pasta breads and such. And we could do a whole topic about sprue and gluten, but that's one thing. H. pylori is a bacteria in the stomach lining that can cause gas and bloating. You can get overgrowth of all these bacteria I talked about in the small intestine, and that can cause increased gas production and therefore some of these gas symptoms.
Okay, so you mentioned gluten. Is there any other things that you should just really maybe not eat, but maybe eat in moderation?
The biggest triggers I talk about are dairy and sugar substitutes.
So as we,
so does everybody. But as we get older, our ability to digest dairy dissipates. We quit making the enzyme in our intestinal tract that breaks down lactose, which is the sugar in milk. And
so this is a completely off-topic question, maybe. Is that lactose intolerance?
Yeah, it's lactose intolerance. Okay. Yeah, it's the same thing. So that can produce a lot of gas, and then sugar substitutes can produce gas for the same reasons. We don't digest those. That's why they're 0 calorie, but they get broken down by the bacteria in our gut, and the byproduct of that can be gas formation.
Okay. Last one here with Dr. Gillespie. Besides eating differently, is there anything else that we can do to prevent excess?
A lot of it's diet. We do have medication like simethicone or Gas-X, which sometimes help, but some people it doesn't really help that much.
Those over the counter or no?
Yeah, it's kind of over the counter Gas-X. And then, if things are not really getting better, we usually will do some testing for things like lactose intolerance or bacterial overgrowth, and we have various ways to test for those things to make sure that that's not causing an abnormal amount of gas.
All right. Well, this has been very productive, and we sure appreciate y'all being here this afternoon. And if you have any additional questions or need to schedule an appointment, website and phone number there listed on your screen. We'll be right back.